My name is Meredith Eastman, and I am the pre-rulemaking task lead here at Patel. And I will start talking about the pre-rulemaking process in just a minute. But before we dive into the content, I just wanted to cover a couple of housekeeping items. You'll notice we've muted all audio lines for this presentation to minimize any background interference during the presentation. We are also recording, and the recording of this presentation will be uploaded to the pre-rulemaking website for future viewing. And we'll talk about that website in greater detail later on in this presentation. Questions about the pre-rulemaking process, about CMS Merit, and any pre-rulemaking resources will be addressed at the end of this presentation. However, we encourage you to enter your questions into the WebEx Q&A feature throughout the presentation as you think of them. So in order to do that, you'll want to click on the Q&A panel by clicking on the question mark in the lower right-hand corner of your screen. Use the drop-down to direct your questions to all panelists. Type your question in the text box and then go ahead and click Send to submit your question. And we'll be collecting those questions throughout the presentation and have time to address them at the end. So with that, I can provide an overview of what we're covering today. I'm going to start with an overview of the pre-rulemaking process. Then we'll talk about CMS Merit, which is the web-based tool used to submit measures to the Measures Under Consideration list, or the MUC list. We'll spend a few minutes talking about some required fields in CMS Merit and provide some additional guidance on how to complete those. Then I'm going to take you on a brief tour of the pre-rulemaking website and show you where to find some useful resources that we've posted on the web. We will have some time at the end for questions. And then lastly, we're going to leave a minute or two before the end of our time for a few poll questions. We'd like to get your input on how we can continue to improve our pre-rulemaking education and outreach efforts. So we're going to reserve just a little bit of time at the end for that. So we do have a lot to cover today. So let's get started with our overview. So Section 3014 of the Affordable Care Act created a new section, 1890A of the Social Security Act, that requires that the Department of Health and Human Services establish a federal pre-rulemaking process for the selection of quality and efficiency measures for use by HHS. The pre-rulemaking process that satisfies the statutory requirement is what we're talking about today, and it can be broken down into three major steps. So first, CMS annually publishes the Measures Under Consideration list, or the MUC list, by December 1st. That list of measures undergoes a multi-stakeholder group review. Then third, the multi-stakeholder groups provide their input on the selection of measures to HHS annually, and that happens no later than February 1st each year. So all measures that are being submitted to programs that are subject to the statute go through this pre-rulemaking process. However, there are a few caveats to that general statement. So measures that are in current use do not need to go on the MUC list again, unless that measure is being expanded into other CMS programs or the measure is undergoing substantive changes. CMS will accept submissions of measures that were submitted but not accepted for a prior MUC list by any CMS programs. So you can resubmit measures that may not have made it on the list the first time around. Lastly, we'll note that measure specifications may change over time. If the measure has substantively changed, you can submit it again for consideration. So as I alluded to previously, the pre-rulemaking process applies to certain programs and measures. It's important to note that not all CMS quality initiatives go through the pre-rulemaking process we're describing today. Specifically, only the 19 Medicare quality programs listed here are subject to this pre-rulemaking process. Other CMS quality initiatives follow different processes for selecting and implementing their measures. So how does CMS decide what measures are selected for the MUC list? There are several factors taken into consideration, and we've listed those on this slide. So, does the measure submission align with quality priorities? Is the submission a digital measure or an outcome measure? Is the measure filling a meaningful measured domain gap for the program to which it's being proposed? Meaningful measures is used to categorize measures and also to note gaps where new measures are needed. In a few minutes, we'll discuss where to find program-specific needs and priorities for the new measures. Does the measure improve upon or enhance any existing measures in the public or private sector? If so, could that original measure be removed? So, does the candidate measure provide opportunities for alignment or reduction? Is the measure evidence-based? Is it fully developed and tested? This is likely the number one reason for a measure to not be accepted to the MUC list, and we'll expand upon what it means for a measure to be fully developed on the next slide. Would the measure be burdensome to operationalize? And is the measure endorsed by a consensus-based entity? So this slide outlines the parameters for what CMS considers to be a fully developed measure for MUC list submissions. Measures that are fully developed are highly preferred by CMS. If you do wish to proceed with submitting a measure that's not fully developed, you can do so, and you have the opportunity to provide additional details regarding the state of development of that measure in CMS Merit. However, in order for you to check that fully developed box in CMS Merit, the candidate measure must meet the criteria that are listed on this slide. So first, patient and encounter level testing for each critical data element has been completed and no changes to specifications are needed. Second, reliability testing at the accountable entity level has been completed and no changes to the specifications are needed. Third, empiric validity testing at the accountable entity level has been completed and no changes to the specifications are needed. So there's an important note here regarding face validity. Completion of face validity testing as the sole type of validity testing does not meet the criteria for fully developed. However, face validity will be accepted on a temporary basis for new measures only. And lastly, there's an additional criterion for measures that are based on survey data or patient-reported tools, and that is that the survey or tool on which the measure is based has been tested and no changes to the instrument are needed based on those results. So, state of development is one of the considerations that CMS takes into account when looking at measures submitted for the MUC list. As I mentioned, programs that are part of the pre-rulemaking process annually identify their needs and priorities for measurement. The 2022 Needs and Priorities Report is now posted to the CMS pre-rulemaking website, and I'll show you exactly where that is when we do our tour of the website. But just at a high level, what you can expect to see in that report is a summary for each program that contains the program's history and structure, information about the number and type of current measures, high priorities for future measure consideration, and program-specific requirements that might apply. So just a few minutes ago, we talked about the three major steps of pre-rulemaking. This circular timeline expands those steps and shows some important interim milestones and where they fall on the calendar. So back in January, that yellow box on the left, we reopened CMS Merit to accept candidate measures for the 2022 MUC list cycle. We're now conducting our outreach and education activities, and the measure submission period will close on May 20th, 2022. CMS programs then review candidate measures, and the draft MUC list undergoes CMS and HHS review. The MUC list is published by December 1st, and then we have our period of multi-stakeholder review that results in a MUC recommendations report by February 1st of the next year. So the takeaway from this slide is that the full pre-rulemaking process extends beyond the one calendar year, and there's often pre-rulemaking activity related to multiple cycles ongoing at any given point in the calendar. So we wanted to share some information about past pre-rulemaking cycles and trends. As you can see on this graph, there has been a trend of decreasing numbers of muck list measures over time, primarily as we've improved communication about measure needs and priorities, and that includes the prioritization of outcome measures and patient-centered and patient-reported measures. I will show you where you can find prior year muck lists on the pre-rulemaking website. Those are all available there. And we're going to just focus in on last year in particular. Last year, we had our successful launch of CMS Merit, which we'll talk about in a minute. We did see a slight uptick in candidate measures accepted to the muck list in 2021, and that's potentially reflective of a backlog due to COVID-19 challenges in the previous year. Last year, there was continued emphasis on testing results in the evaluation of candidate measures, and we maintained the focus on the application of CMS measure priorities in the evaluation of candidate measures. So that concludes our overview of the pre-rulemaking process, and we'll spend the next few minutes talking about how one would go about submitting a candidate measure for the muck list. The short answer to that is the way to submit a measure is through CMS Merit. So CMS Merit has a long full name. It's the Centers for Medicare and Medicaid Services Muck Entry/Review Information Tool. And it's the tool for measure developers to submit their clinical quality and efficiency measures for consideration by CMS. CMS Merit is also used for facilitating searches of measures from the current year and previous years, and for structuring the workflow for CMS review of measures that are submitted to the muck list. This year, CMS opened on January 28th for the 2022 cycle, and it will stay open for submissions until 8 p.m. Eastern on May 20th. So that's an important deadline to remember. Again, last year was the first year that CMS Merit was in use, and it has several features that have improved the muck list entry and review process, including automatic completeness checks, the ability to save submissions and return later to complete a submission. There's a review process tracking ability, so submitters and reviewers can track their progress of their measures. And it has an easy to navigate interface that incorporates principles of human-centered design. For this year, based on feedback from users, we've added a few new features that we think will further improve functionality of the tool and the measure submission process. So you can now click on and keep open field level guidance. Previously, we had hover over text. Now you can actually click and keep open the guidance for each field in CMS Merit. You also have the ability to clone a measure from a previous submission. So you don't have to start completely over from scratch if you are resubmitting a measure that was previously submitted. And we have a simplified method for adding co-submitters this year. One thing that has not changed in CMS Merit is that required fields are noted with a red asterisk throughout the tool, and these asterisk fields must be completed in order to successfully submit your measure. So I'm now going to turn it over to Carolyn Lockwood from HSAG to talk in greater detail about these required data fields.
Thanks, Meredith. As Meredith noted, there has been several refinements and revisions made to Merit from the functionality features. Additionally, there have been refinements to the data required and how it is presented. These refinements were made to continue to support CMS in addressing the U.S. Government Accountability Office, or the GAO's, recommendation for relative to systematic measure assessment, alignment, and additional refinements have been made in Merit. Some of these refinements that you may note include, but are not limited to, adding guidance and providing reference links to assist in clarifying the required measure information submission requirements, reorganizing the structure of the information to improve the flow, and the increased use of discrete data fields to standardize and streamline the collection of measures data. Next slide, please. So let's take a look at an example of where some of the refinements have been made. It's particularly in the section related to testing. First, reliability and validity data fields are now organized by the level of testing that has been conducted. Accountable entity or measure score level, data element or patient encounter level testing. This allows the submitter to submit the results associated with the level of testing conducted and CMS to review the associated results appropriately. Discrete fields are provided to collect the results for each level of testing conducted. If multiple results are available, follow the guidance associated with each to determine which result to report. If you have additional testing results or testing documentation that you would like to provide, please put that in an attachment to the measure that is being submitted. To note, for MIPS submissions, please provide in the discrete fields the testing results at the individual clinician level and attach in your attachment your group level testing results. Next slide. On this slide is an example of the discrete fields that have been added related to reliability testing, focusing on the testing at the accountable entity or measure score level. For this, the measure submitter would have selected yes, that accountable entity level or measure score testing was conducted. Additional questions will open based off of the selection of yes. If no was selected, the subsequent fields shown would not be visible. However, since the submitter selected yes, that accountable entity or measure score level testing occurred, additional fields open for the submitter to select the type of analysis conducted. The choices are signal to noise, random split half correlation, or if neither of those tests were conducted, select other and enter the name of the analysis performed. Based on the type of analysis selected, subsequent fields open for the submitter to enter the name of the statistic conducted, corresponding sample size, the statistical result, and interpretation of a result. Guidance to each one of those are available in the definitions or in the downloaded template. As a reminder, if you have additional information related to testing that does not fit in the discrete fields, please provide that as an attachment. Meredith?
Great. Thanks so much, Carolyn. So there are several ways to get help with CMS Merit. First, a great place to start is the Quick Start Guide, which is available for download from the CMS Merit login page. And there's also the Word template that contains all of the CMS Merit fields, as well as the guidance that you'll see within the tool itself. It's all in that Word document. And those resources are available for download without even having to log into the tool. Additionally, we are holding another session specific to how to use CMS Merit. We're calling it CMS Tips and Tricks, and that is scheduled for April 21st. And we will focus on reviewing the features of the tool, particularly the features that were added this year. And I think we can pop the registration link to that in the chat. And then if you have questions that are not addressed in any of those guidance materials, you can also send us an email at mmssupport@patel.org. That is the inbox for CMS Merit questions, in addition to general questions about the pre-rulemaking process and requirements. So before we go ahead and open things up for questions, I did want to take us on a brief tour of the pre-rulemaking website so you know where to find pre-rulemaking resources. So just give me a moment to do a little choreography here and I will share my screen. Okay, I think that worked. So at the top here, you can see there is just a table of contents to help you navigate along the page in major sections of the page. And we start with an overview, which covers the statutory requirements for pre-rulemaking and some of the major steps that we discussed earlier. We have general guidance for measure submissions, including information about measure priorities. In here, we have events for this year in a nice linear format instead of that circular slide that I showed a little while ago. The same information just presented in a different way. And we have information about how to submit your measures using CMS Merit. And then we have information about the multi-stakeholder review process. You can access previous multi-stakeholder group reports here in this section. And then right below, this is where you will get previous measures under consideration lists. So you can actually download muck lists from 2011 forward right here on the web page. But this is really the section I wanted to make sure that we spend some time on. This is the additional resources for pre-rulemaking, and this is a great place to go if you have questions or if you need help with the pre-rulemaking process or with CMS Merit. So first, we have a PDF of frequently asked questions that gets updated every year. And it's a really handy document that will cover a lot of what we talked about today, but that also has information about specific requirements for ECQMs and for the MIPS program. And the MIPS program has some specific requirements associated with it. For example, a peer-reviewed journal template that accompanies the measure submission. So that's available for download here, as well as call for measures fact sheets and examples of how to fill out that peer-reviewed template are all available for download on this website. We also have the CMS Merit Quick Start Guide, which is also available to download from the CMS Merit login page. That Word template with all the fields and guidance for all the fields. This is where we have the slides from today are posted here, and we will post the recording of this presentation in this section of the page, along with the recording of the CMS Merit Tips and Tricks session that we're holding in a couple of weeks, April 21st, will be posted here as well. Last but not least, I wanted to show you where to find the MUCList program-specific measure needs and priorities report. It is right here at the bottom. Again, this gets produced annually. It is a chance for you to see what programs have prioritized for measurement, and it also provides information about any program-specific requirements that you'll want to take into consideration. At the very bottom here, we have our link to the MMS support email address, which you can use for any questions about pre-rulemaking or about CMS Merit. Last minute, I just want to thank you all for attending. Kim and I are your primary contacts for the pre-rulemaking process and for CMS Merit. We invite you to contact us at mmssupport@battelle.org with any questions, and I hope you all have a wonderful rest of your day. Thank you so much.